Welcome to Health IQ, a podcast from the Quay County Health Council. In this podcast, we are exploring a variety of health topics that affect our community and probably yours too. We are not professional podcasters, but volunteers that have a passion for wellness. We will share practical ideas and resources for people with limited access to services, and we have some fun tips to help you and your family stay healthy and well. Increase your health IQ as you listen to our members as they talk and share with experts and others about the health matters that matter to you.
Health IQ Podcast. Helpful Harm Reduction Practices, Episode 22, Narcan, Syringe Exchange, and more.
For many of us, the concept of harm reduction is not a familiar one. We hear things in the media like we're going to give substance misusers the supplies they need to continue their habit for free, and we don't understand how that helps the situation. So today we're going to explore harm reduction with our Quay County Public Health Nurse, Rickie Eslick, and learn how this can be of help to those suffering from substance addiction. So thank you, Rickie, for joining us today. And just our crew today is Joyce Runyon and Bobby Hockaday, and of course, I am Brenda Bishop. So I thought we'd just start our discussion with a description of what harm reduction is and why we think it's important.
Okay.
We think it's
so harm reduction, what we do in our office is we help people to reduce substance-related harm, to themselves, their family, or loved ones. All of our information is kept confidential. It's to help prevent risk reduction and health promotion. I know a lot of people don't understand it, or they say it enables, problems, but we want to reduce the risk of people reusing needles and exposing themselves or others to hepatitis or HIV. We want to give people Narcan to help with any type of opioid overdoses or things like that. And just different other things that we do there.
I saw a thing on one of the news shows about a family who's, like 2017 or something, daughter died from an opioid overdose, and they formed a foundation, and their whole goal is to get Narcan out into the communities to save lives. So it does save lives, and they have data that shows how many lives it saves.
Yeah, it does. And right now in New Mexico, you can get it over the counter, but I'm not sure what the cost is at the pharmacy. But if you can't afford it, you can always come to our office and we will give it to you. You just have to sign a confidentiality HIPAA release form, and we'll provide it, and we'll teach you how to use it. We'll teach you to look at the expiration date because it does have expiration dates. I know there's been a few cases where dogs have gotten medications or different opioids, and they've been like overdosing, and they've used Narcan on dogs.
Yes,
So it is important to get that out. The same thing with our syringe exchange. We do that to help people. We do it for people that use illicit substances, or even if you're diabetic and you can't get your syringes elsewhere, you can come to our office, and we collect those used syringes as well.
I had a child who was on a medication that was by syringe, and they sent the little thing to put the syringes in, but we didn't know what to do with the syringes when we were done with them.
Yeah, you can drop those off at our office. Our office is at 310 South 2nd in Tucumcari. And we have a drop box that if after hours or you don't even want to engage with us, it's on the outside of our office. It's on the south side, which faces the alley. And it's marked, and you can just open it up and put your syringes in there. You don't have to tell us. You don't have to engage with us. If it is a bigger container, though, you probably will have to come inside and just let us know that you have something to drop off. And the same thing in the community, if you see needles that are out, at the park or wherever, if you call us, we will go get those. We haven't had anybody call us. So.
Because, we don't want to have that kind of stuff just lying around in
Yeah.
where kids could get a hold of them,
Yeah.
or step on them, or
if you see anything, just definitely let us know and we can come and get those. But it is important. It helps, like I said, reduce harm related to like transmitting bloodborne infections like hepatitis or HIV. It does. We say, like, if you use your syringe, go ahead and rinse it out before you dispose of it, and then put it in your sharps container.
okay.
Okay.
So I can also remember reading something, and this may have been just related to when we didn't have services here, that there's some mail order needle exchange as well if you don't live near a health office.
There are, but I'm not sure where those are at. They have a website that you can look that up and contact those people that will do that for you.
Dose of reality, maybe.
Yeah, and I have those written down, and I'll make sure that you guys get those. But yeah, I think it's Dose of Reality, and it says on there, there's a number or an email that you can contact and get that.
So that could be helpful if you didn't live here close into town or didn't have transportation.
And we also have an office in Fort Sumner. They didn't do harm reduction before, but they received approval, and now they do harm reduction. The same thing, they do Narcan, syringe exchange, and they also have a drop box that was just recently placed in their facility. So that's something new in Fort Sumner.
That's cool. What about Hardin County? I know that the health office is there like once a week or something, not ours, but
I don't know about Hardin County.
Yeah.
I wish I did because we're close, but I really don't know what they have over there.
Well, there are different regions.
Yeah, they're a different region, even though they're close. So, okay.
So what other services around harm reduction do you have? We talked about needle exchange, Narcan.
Other services that we do offer is for harm reduction. We do things like STD testing. It's really hard sometimes to get people to come in there. So I do sometimes offer gift cards if they'll come and get tested and then come back for the results or treatment. We can do HIV and syphilis testing, just an instant one. Takes about 10 minutes in the office. That way you don't have to stay there the whole time. We could do that. We offer free condoms. Anybody can come in and get condoms. They don't even have to talk to us. They're just in the front of the office. We also are starting to offer like the MAT services or the MOUD. If people are interested in that, we can do that. Telehealth also. So we have some of those.
MAT services are medication-assisted treatment, and its purpose is to
just to help people if they would like to decrease their usage or get off of opioids. It's not just for illicit drugs. It's also for people that have been prescribed pain medicine and can't kick that habit and can't get off of that. It does help you kind of decrease that and get away from using those substances. So,
okay. I heard something somewhere, and I didn't ask you before, but is there MAT services for people with alcohol?
That I don't know. We don't have it right now in our office, but I'm sure there is.
I was just thinking I had read something somewhere.
Yeah. I don't have that in my office right now. The mostly that we do is the illicit drugs like fentanyl and if you have the prescription opioids, oxycodone and stuff like that.
Okay. And I know that some test strips came out to help people with identify their illicit substance to see if it has any fentanyl in it.
Okay.
And I think that's something pretty new to our community to have those. We've had them. Have we had them even a year?
I have had the fentanyl strips for a while. So with the fentanyl strips, if you're using either a liquid illicit drug or a pill, you can test it with the fentanyl strip. And when you come into our office, we can provide those to you. I will show you how to use it. I'll show you how to read the results. And also they have now xylazine. I don't have those in my office yet, but I have ordered those. And so I'm not exactly sure yet how those quite work, but I'm sure they're about the same way as you do with the fentanyl strips. Once I get those in, anybody can come and I will show you how to use those as well.
Maybe for some of us who are sort of new to all this information, why is it important to test for the fentanyl in our substances? Well, I think we probably know that from the news, but the xylazine.
So the xylazine is actually like an animal tranquilizer, and that can be in your substances and you not know it, and it can really do some harm. Fentanyl can be in your substances also. So the strips will test if there's something there, but it doesn't tell you how much is there. A lot of people in our community do use fentanyl anyway. The xylazine, if they have that in their substances and they overdose on that, we can use Narcan on it, but it's not probably going to help them. There's not really anything yet to do to give them for a overdose of the xylazine, which is really unfortunate. So,
okay. So, are there other things that you're offering as far as harm reduction is concerned from your office?
We do the syringe exchange, we do Narcan, we do STD testing. If we need to, if somebody's interested in it, we can offer PrEP or PEP for HIV reduction or protection. I'm trying to think what else. And then the strips if they need it. So
then I guess the next question is, if somebody wanted to access some harm reduction from your office, what are the steps they need to go through to do that?
So our office in Tucumcari offers the syringe exchange or the harm reduction program Thursdays, 1 to 4. If for some reason you can't make it that day, you can always come to our office. It's open Monday through Friday, 8 to 5. And you'll come in and we'll just kind of discuss with you what you're using, how often, what you might need your syringes for if you want that. We also do smoking supplies. So if you don't do syringes and you just smoke, we have those supplies as well. We kind of do like an interview process just to understand like what's out in our community and how often people are using, or if you're looking for help. We try to help you find resources, counseling if you need that, or other things. You just come in, we'll give you a card. It has a code on it. It doesn't have your name or anything. It's just your code. You bring that card with you to our program or any program that they have in the state, and they'll exchange with you. You'll bring your used syringes, and we'll exchange clean syringes or sterile syringes for you. And Fort Sumner does the third Tuesday of the month because they don't really have a whole bunch of people there because it's still brand new. And we do that from 10 to 3 there.
But it's here every Thursday from 1 to 4.
Yep. And if it's a holiday or we're not going to be there, we do post that and let people know pretty far in advance. So that way they can make different arrangements.
So when they come in if they have already consulted with you, do they have to go through a consult again when they come in every Thursday, or
no?
Just
what we do is you'll come in, we'll go through all the information. If you get Narcan, we'll show you how to use it. We'll explain all of that. And as long as you have your card, the Sharps card is good for 2 years. The Narcan we do every year, and we'll just at the end of that time we'll redo it. If you lose your card, we will redo it at that time also. And we have a back door of our office that faces kind of out to the street, or, on the back of the
alley.
Yeah. And you can come in the back door, or you can come in the front door if you prefer. A lot of people don't really like to do that because they don't want other people to see them coming in, and that's fine. But we do have a back door, and we only have one person come in at a time. And it is myself and my clerk, Lizette, that helps me. And we do that. So, and we always have to have 2 people for safety reasons. So if we don't have a second person, we won't do harm reduction that day also.
Well, that makes sense.
Yeah.
And requirements, is there financial requirements or
No.
income guidelines or
No.
anything?
Some people are concerned that they have to have a driver's license. You do not. You just need to come into our office and ask for harm reduction services. And we've had people come in that are quite a bit younger, but maybe their mom, dad, brother, sister uses items and they want to have Narcan just for safety. We've had younger kids that have used the Narcan on their parents and saved them. So that's important that anybody can come in and get those services.
That's wonderful. That's cool.
Yeah. And
So did we cover everything you wanted to cover about harm
let me
reduction?
see. Oh, those websites, the
Yes.
doseofreality.com, and they do have a phone number. It's 505-270-5943. There's also neverusealone.com. We do suggest that if you are going to use illicit substances, that you don't do it alone, just in case something happens. Let your partner or friend or somebody know, and that way they can check on you and make sure you're doing okay.
Well, you can't administer Narcan to yourself.
Exactly. You're going to have somebody there to help you in case you need it. And then there's also the New Mexico or nmcrisisline.com. And there's phone numbers for all of those too. And those are different things that'll show you if you're in Albuquerque, where can you get harm reduction? Or if you're in Santa Fe or anywhere in the state, where can you find those services? Where can you drop your syringes? Where can you get Narcan? And there's also a website connected to these where you can order your Narcan online as well.
I think I saw that. I think Rochelle found that, and we put it up on our social media online Narcan.
Yep, you can do that as well. So, and then I just want people to also know, if you find somebody that you suspect is overdosing, try to do what you can to help them, follow like the guidelines of CPR if you can. And we teach people when they come into our office these things. Give them Narcan. Definitely call 911. If they don't want to stay with them, at least, give them the Narcan, put them on the side, and do the best that they can. So,
Right.
we just encourage you to do what you can for your friends. So, anything else?
So, we do end our episodes with a food for thought.
Okay.
And I had two, and I think this one sort of fits with what you discussed today. I see harm reduction as a way of engaging people as part of that path to recovery, by Paul Eckler. And I thought that really is what harm reduction is. It's not to help people stay in substance misuse, but it's to help them stay alive to get help.
Right. Yeah, that is one thing we like to do. We want to build a relationship, a trusting relationship, and have people come to us and provide them with resources of how they can get, MAT services or counseling, and help them, get the recovery if that's what they choose. We've had some that do go to rehab, and some that decrease their usage just because they've come to us and they've found resources that they've needed. So yes, that's part of what it is.
So that makes it worth it, just to know that people got the resources and the confidence maybe to go out and
find what they need, their help.
Access that help. Because I think that's part of the whole challenge too, is the help might be there, but
you don't know
there's
how
such
to
a
find it.
stigma that we don't want to access the help.
Yep, that is very true. Definitely. So,
Well, this has been interesting. I'm glad to know that we're getting even some new services like the MAT and the xylazine strips here.
Yep, definitely.
And we have the fentanyl test strips, which we didn't have for a long time. So that's wonderful too. And I'm hoping that we can get more people to realize that they're there available so that they can test their substances before using them.
Yep. I just also wanted to say, if you come into our office and myself or Lizette, we're not there, you can stop at the WIC office with Ruth or Leah, and they will leave us a message and let us know to contact you or that you've came by.
Okay, that'd be great.
Okay.
We should give the phone number.
Oh, yeah. The address is 310 South 2nd in Tucumcari, and the phone number is 575-461-2610.
Thank you.
Mm-hmm.
And thank you all for joining us today. Be sure to come back for our next episode of Health IQ Podcast, as we will be sharing about a fun project we are doing here in Quay County.
Okay, thank you.
Well, there's a couple things as we were reviewing that we want to make sure we highlight. So Why don't we go ahead and do that right now?
Another thing I just wanted to make sure people know is that we do provide sharps containers. If you need a sharps container, we have various sizes. We also have some that you can put in your pocket. They're pretty small. So we would like people to come in and get those sharps containers and try to avoid using bags. We have several people that drop off in bags, and that's a danger to yourself and also the staff that's picking those up. So we do have sharps containers to provide if you need those.
Oh, wonderful.
So
anything else that you think that?
I think that covers it now.
Right. I didn't even know they made pocket size.
Yeah. They're very small, and they fit about 10 to 15 syringes in them. And I have taken some to the police officers here in town, the state police, the county, and the city. I've had one or two of the officers say that they just put it in a plastic bag or a glove. And I'm like, no, I want you to be safe. So we make sure that they have them as well.
Oh, that's excellent. Wonderful. Mm-hmm. Because, they do sometimes run across stuff, and I'm sure they don't want to leave it.
Yeah. So instead of, putting it in a bag, we have sharps containers for everybody. Just come to our office and we can get it for you.
Special thanks to our guest contributor for this episode, Rickie Eslick, New Mexico Department of Health RN Supervisor for Quay and Debaca counties. Our host was Brenda Bishop, Quay County Health Council Coordinator. The Health IQ crew. Director is Robert F. Hockaday. Producers video audio are Robert F. Hockaday and Joyce Runyon. Second AC was Joyce Runyon. Editors are Joyce Runyon and Robert F. Hockaday. Select music provided by David Morris. Funding for Health IQ provided by a New Mexico Better Together grant. Brought to you by the Quay County Health Council. Follow us on YouTube, Facebook, and Instagram at Quay County Health. If you have any content ideas, reach out to us by email healthhiqpodcast@gmail.com. More info about this topic and more available on our Health IQ blog, qchealthhcouncil.org.
This podcast was created solely for educational and entertainment purposes. It is not intended as a substitute for advice from a healthcare or mental health professional.